Hello, my name is Sean Edwards. I'm a firefighter paramedic with York County Fire and Life Safety. Today we will discuss the PEMS 2020 protocol updates. This year, there are administrative, protocol, and pharmacology updates. We will also go over some best practices that are expected of EMS providers. Starting off with administrative changes, providers are now allowed to accept out-of-state DNR or DDNRs. This can be the original, photocopy, or alternate DDNR jewelry. A general universal care change for IOs now allows advanced providers to insert IOs as a standing order. A new change to the patient refusal protocol has been made. The verbiage when medical control will be contacted has been changed from ALS care has been established and the patient refuses transport to if a 12-lead EKG has been acquired or a medication from the PEMS medication box has been administered. The following protocols listed below have been modified and include adult allergic reaction, cardiac arrest post-care, medical altered mental status, general adult pain control, general adult behavioral, medical respiratory distress, pediatric section, pediatric allergic reaction, pediatric pain control, all epinephrine references. Starting with the adult allergic reaction protocol, PEMS has revised the definition of anaphylaxis to include possible GI symptoms, removed brackets for AEMT administration of diphenhydramine, replaced epinephrine IV bolus with an IV drip, added EMT IM administration using either color-coded or clearly marked syringe, removed brackets for intermediate administration of solumedrol.
This slide shows the updated criteria for identifying a patient in severe allergic reaction or anaphylaxis. It's based on information obtained from the American Academy of Allergy, Asthma, and Immunology, as well as the American College of Allergy, Asthma, and Immunology. As a reminder, always treat the patient and their symptoms. For example, a patient with alpha-gal, the allergic reaction to red meat, onset may be 6 to 8 hours after ingestion, after the protein has been digested by the body and the body responds with an allergic reaction. Intramuscular administration of epinephrine is the initial treatment for anaphylaxis. However, if the patient remains refractory to IM injections, the intermediate or paramedic can consider administering an epinephrine infusion. This infusion replaces the previous protocol of epinephrine IV bolus in both the adult allergic reaction, pediatric allergic reaction, and both adult and pediatric respiratory distress protocols.
The Virginia Office of EMS has added the administration of IM epinephrine for anaphylaxis for the EMT. An EMT must use either a dose-specific clearly marked line or color-coded syringe. It is the responsibility of each EMS agency to ensure their providers have the appropriate training. PEMS staff is available to assist upon request.
Please note that after May 1st, the emergency epinephrine auto-injector medication box will no longer be stocked by pharmacies within the PEMS region. Prior to that time, agencies need to ensure that their EMTs are trained to the standard established by their OMD. PEMS staff has resources and are available to assist those agencies upon request. This slide shows the 2020 protocol for IM epinephrine injection by the EMT with either the dose-specific, clearly marked syringe such as EpiRite or the color-coded syringe such as Certidose. Please note that you can repeat the IM epinephrine injection every 5 to 15 minutes for up to 3 rounds if the patient is not responding. When administering epinephrine with the EpiRite syringe or similar product, a provider will choose to draw the medication to one of 3 lines based on the weight of the patient. For children 44 pounds and less, the provider will draw epinephrine to the 0.10 milliliter line. For children between 44 pounds and 66 pounds, the provider will choose the 0.15 milliliters line. Children and adults above 66 pounds, the provider will draw to 0.30 milliliter line. EMS providers within the PEMS region will find the syringe with a dose-specific, clearly marked line. The next slide will illustrate an example called the EpiRite that may be present. However, others of similar design may also be found.
The EpiRite syringe is another option that may be included in the drug box for your IM administration. Here's a closer view of the EpiRite syringe, clearly marked to help eliminate dosing errors.
Instead of just a vial of epinephrine, a provider may find an ampule with a filter straw. The medication is the same, however, there are a few additional steps the provider must take before administering the epinephrine.
The cardiac arrest post-care protocol has a new norepinephrine dose, and paramedic providers now have the option of an epi push presser as a bridge to their epi drip. The change in the norepinephrine makes dosing easier, and the push presser will shorten time to get medications into the patient while a drip is set up. The altered mental status protocol now allows EMTs to administer Narcan IN. The dose range is 2 to 4 milligrams. The Office of EMS recognizes that some naloxone packages are 4 milligrams, originally limiting the use of naloxone from the PEMS medication box. This allows an EMT to administer naloxone IN that is stocked in the PEMS medication box. In the general pain control protocol, advanced providers can now administer Toradol under direction from medical control. A pearl was also added for providers to call medical control prior to administering Toradol to a multi-system trauma patient. The new medication has been added to the general behavioral and patient restraint protocol. Paramedics now have the option of administering ketamine 4 milligrams a kilogram IM. The MAC recognizes B52 is not always the best medication for patients in a behavioral crisis, especially when the pathology is trauma. There has been several changes to the medical respiratory distress protocol. With regards to the status asthmaticus patient, the epi-IV bolus has been replaced with an epi-drip. Mag sulfate is now an option for patients with asthma, COPD, emphysema, and chronic bronchitis. PEMS added a pearl that mag sulfate is not indicated for CHF or pulmonary edema. A few changes have been made to the pediatric section. An age-based vital signs reference chart has been added to the front of the pediatric section. The pediatric allergic reaction changes include: PEMS has revised the definition of anaphylaxis to include possible GI symptoms, removed brackets for AEMT administration of diphenhydramine, replaced epinephrine IV bolus with epidrip, added EMT IM administration using either color-coded or clearly marked syringe, removed brackets for intermediate administration of solumedrol. PEMS has aligned anaphylaxis definition with current definition and brought PEMS providers to Virginia OEMS scope of practice. A new option for pain control for the pediatric patient has been added. Intermediates and paramedics now have the option of giving fentanyl at 2 micrograms a kilogram IN.
Here is the section of the pediatric pain control protocol with regards to fentanyl. As indicated, an intermediate may still administer morphine, but now may also choose fentanyl IN under med control. Paramedic may administer either. Providers should expect to see new references to epinephrine in the medication box. Epi 1 to 10,000 will include 1 milligram per 10 milliliters. Epi 1 to 1,000 will include 1 milligram per milliliter. Providers may find either packaging of epinephrine in the PEMS medication boxes during this transitioning and packaging. The following is an example of what the old and new packaging will look like in the PEMS medication box. Updates to the pharmacology section include changes to the following 6 medications: Toradol, D10, D50, ketamine, fentanyl,
and epinephrine references. Under the precautions section of Toradol, verbiage has been added to ensure providers call medical control before administering the medication in multi-system trauma patients.
The hypoglycemia criteria for pediatric patients other than newborns and neonates has been changed for 2020. The glucometer reading will now be less than 60 milligrams per deciliter instead of 40 milligrams per deciliter. This just aligns the PEMS protocols with the current evidence-based criteria published by the American Pediatric Association.
A ketamine pharmacology page has been added for providers to reference this new medication in our drug box. The fentanyl pharmacology page has been updated and the verbiage "not currently indicated for pediatric use" has been removed. The pediatric fentanyl dose is 2 micrograms a kilogram IN up to a maximum dose of 25 micrograms. As noted earlier in the presentation, providers need to be aware of the new epinephrine references in the PEMS drug box. As a review, PEMS wanted to emphasize some best practices to ensure a safe and professional work environment. Please be proactive when it comes to patient care and security of the PEMS medication box. PEMS encourages agencies to make it a habit to check the seal on the medication box daily to ensure it is intact and matches the number of the medication box exchange card. If the tag is missing or broken, return it immediately to the pharmacy. Prior to exchanging a used medication box, please ensure trash and sharps have been removed. If a patient does not respond to a medication as you would expect, for example, no pain relief after the appropriate dose of fentanyl, please submit a medical incident report. A designated agency representative may request advanced distribution of 2020 protocol changes in preparation for printed distribution within the agency. Email Seth Craig to request advanced distribution. Protocols may not be released into the field until March 1st, 2020. Protocol development takes the hard work of many individuals and is a continuous process. All protocols are endorsed by the Regional Medical Advisory Committee prior to implementation. If you are receiving negative feedback from ED staff because of protocol changes, please consider notifying your supervisor and documenting your experience in a medical incident review form available on the PEMS website. Please join the PPP committee if you want to be the change. Thank you for watching. Working together is the only way we make the system better. Thanks for your help.
This hyperlink will lead you to a YouTube video illustrating IM injection. This link will take you to a YouTube video regarding the steps required to administer a medication such as epinephrine from an ampule instead of a vial. This last section is optional as an additional resource to those agencies who choose to implement Certidose within their agency. This is the epinephrine convenience kit. It includes a vial of epinephrine as well as a color-coded syringe.
This slide shows a close-up view of the syringe used in the Certidose kit.
This hyperlink takes you to a YouTube video regarding the Certidose epinephrine convenience kit.